Colorado was the first state to legalize abortion in 1967, more than 5 years before Roe v. Wade. Now, since then, the Centennial State has become a safe haven for women seeking abortions. Now, currently in the state of Colorado, there's no age limit on when an abortion can be performed, but some are looking to change that. I spoke with representatives from Planned Parenthood of the Rocky Mountains, an OBGYN, Democrats for Life of Colorado, and the Pregnancy Center here in Grand Junction to learn more about abortion and the proposed legislation here in Colorado.
We see a ban introduced in the legislature virtually every session, and it always goes down.
Vicki Cowart, CEO and president of Planned Parenthood of the Rocky Mountains, says voters in the Centennial State have voiced their opinions on abortion rights numerous times.
Colorado voters have been very clear. 3 distinct times with ballot initiatives where voters said in large margin that they believe that a woman ought to be able to make this healthcare decision on her own with her doctor, and nobody else needs to be in that conversation.
Dr. Tom Perrill, president of Democrats for Life of Colorado, aims to persuade voters in the opposite direction.
Petitions are beginning to be circulated to outlaw abortion after 22 weeks. Democrats for Life of Colorado is strongly in favor of that kind of legislation because we think it's an area where virtually all of Coloradans can agree that a 22-week-old fetus is a viable human being.
Viable, a term used on both sides of the abortion debate, but it's also a medical term.
How viability is defined in obstetrics and gynecology is the ability of a fetus to survive outside of the uterus.
Dr. Rebecca Cohen, a Denver area obstetrician and gynecologist, says the viability of a fetus depends on a number of factors.
Due to medical concerns with the fetal heart, the fetal lungs, the fetal brain, regardless of gestational age, there are some fetuses that may not ever become viable.
But many pro-lifers see it differently.
I personally think that human being deserves recognition, and it has inherent dignity and value from conception until natural death. However, we live in a democracy where I need to persuade the majority of Coloradans that that's the case.
Currently in Colorado, organizers are working to collect over 100,000 signatures to add a measure to the 2020 ballot, which would ban abortions after 22 weeks gestation.
This is a terrible thing to do to a patient-doctor relationship, to have a politician say, this is how you will practice your medicine. And for Planned Parenthood, it's a bridge too far. It is unethical.
If passed, the measure would mean the doctor could face a misdemeanor, a fine, and a 3-year suspension of their medical license for performing or attempting to perform an abortion after 22 weeks.
These kinds of bans put lives at risk as a result and make lives miserable.
The proposed measure does make an exception for medically necessary late-term abortions to save the mother's life, but it does not make exceptions for rape or incest.
They're not intended to help women make better decisions. They're not intended to help women's health. They're not intended to do anything other than to restrict a woman's ability to make her own decision about her health care.
Dr. Cohen says late pregnancy abortions are fairly rare and typically connected to a very serious health concern.
In the United States, almost 90% of abortions are performed very early in pregnancy, so early in the first trimester. Later abortions happen for a variety of reasons, but they're most often related to either maternal health or severe fetal anomalies that we don't know about until later in the pregnancy.
Still, many pro-lifers believe even a non-viable fetus should be carried to term.
For those that are clearly failed and when there's no therapy for, we think that perinatal hospice is a far more loving, compassionate, and life-affirming approach.
Perinatal hospice care is an option that supports parents in their decision to deliver a baby that might die before or shortly after birth.
With perinatal hospice, there's still a lot of unknowns. There's often a lot of expense. So while that is an option that we may present to people, it's certainly not an easy option, not a necessarily equal alternative.
Dr. Cohen says it's a choice that's not right for everyone, just as abortion is not.
The so-called choice for an abortion, when you dig deeper, is frequently coercion.
A sentiment that Dr. Cohen can't agree with.
We really, look at the health of the mother, the health of the fetus, and offer later abortion as a compassionate choice in many situations. It's not something that we as medical providers force upon pregnant women. It's something that is often, a choice in what is a very, very, very difficult situation.
For part one of this story, check out our web channel, westernslopenow.com, and feel free to voice your opinion on this matter on our Facebook page. First on the Western Slope, Shelby Bracho, KREX 5 News.